Hi, good afternoon, everyone. Yeah, today my topic is on gynecological cancer, and also to look at the Ganoderma. How can Ganoderma use as complement treatment to the cancer? Next. Yeah, first we have a disclaimer. All the information contained in the slides are intended for general health information and educational purposes only, and are not intended to be used as a substitute for a professional medical advice, treatment, or care. Yeah, first we look at the cancer statistic in Singapore. Um, Look at the data, the cancer trend from 1968 all the way to 2018. Yeah, based on the data collected for 1968, between 1968 and 1972, we have about 12,000 new cases just for cancer itself, okay, in Singapore, and 18.9, no, 189 per 100,000 population, okay. But if you look at 2014 to 2018, also on the 5-year collection of the data, we have a 28,000 new cases. And based on 100,000 population, we have about 232. So we look at the number from 189 per 100,000 from 1972, and now 2018, 232 is on the uptrend. And you look at the cancer death itself, in 1972, the 5-year data collected is 5,008, okay, and that equate to 93 per 100,000. Yeah, so we look at the anatomy. Um, so the female reproductive system consists of 2 ovary and 2 fallopian tubes, and the uterus that actually is attached to the cervix and the vagina. First, we look at the ovaries. So ovary is a small oval-shaped gland located on either side of the uterus. The function is to produce eggs and hormones. Number two, it's connected to the fallopian tubes. So narrow tubes that are attached to the upper part of the uterus. So this will serve as a funnel for the ovum, which is the egg cell, to actually travel from the ovaries to the uterus. Okay, for conceptions, the fertilization of an egg by a sperm, actually they meet at this point so that they can actually conceive, and normally occur in this fallopian tube. So once they meet, they actually move to the uterus and implant to the lining. Number three, for the uterus, which is the womb, a narrow pear-shaped organ that is the home to develop fetus, divided into two parts, cervix lower part that actually open into the vaginal corpus. So this actually allowed them to easily expand to hold a developing baby. Yeah. Number four, cervix is the neck-like structure at the base of the uterus, connecting the uterus to the vagina. So the last one, which is a vagina canal that actually is a canal that joins the cervix at the lower part of the uterus to the outside of the body, also known as birth canal. Yeah, next. Now we look at the function of the female productive system. The first function is to produce female egg cell necessary for the reproduction, called the oval or the ovocyte. Next is to transport the ovum to the site of fertilization. Conception is the next function. The fertilization of an egg by sperm normally occur in the fallopian tubes. So the sperm and the eggs have to meet at this point. Implant the fertilized egg into wall of uterus, beginning the initial stage of pregnancy. Next is to if the fertilization doesn't take place, the system is actually designed to menstruate menstruate the monthly shedding of the uterine lining, so to actually flush away, yeah, if it's not fertilized. Next is to produce the female sex hormone that actually maintain the reproductive cycle. So the sex hormone they're referring is the estrogen and progesterone. Yeah, next. Yeah. So now we look at the tumors at the pelvic area, which is actually belong to the reproductive system. So not all tumor are cancer. So here we have a benign and malignant. So benign tumor actually we have uterine fibroids, endometrial cysts, ovarian dermoid cysts, and ovarian endometrial mass. So what's the difference between a cyst and the tumor? So a cyst is actually a liquid type of mass. As for tumor, it's more like a tissue type of mass. So these are the two differences. Okay, so this benign tumor is actually non-cancerous, which means they actually will stay in the local position, and you will just grow from there, but it will not actually spread to other side. Yeah. Next, we look at the malignant tumor. So this is the one that actually will spread to other side, which will actually affect a lot of other organ and other function of the system. So the first one we look at is ovarian cancer, uh, endometrial cancer, cervical cancer, and the last two is quite rare, but it is also um, type of the cancer, vaginal cancer and the vulval cancer. Yeah, the first three are quite a common cancer among the women. Yeah, next. So first we look at the gynecological cancer. Yeah, for gynecological cancer, actually these are the cancer that actually start in woman reproductive system, which actually include ovarian, uterine, and cervical cancer. So these are the three most common type. First, we look at the ovarian cancer. Um, this is the type of cancer that actually begins in the ovaries, often goes undetected until it has spread with the pelvis and abdomen. So until you will feel some pain, and these are the few symptoms that you will actually need to actually see doctor. Then you will actually start to actually have realize that okay, you may have all this type of cancer. So initially it is hard to actually detect. Yeah. We look at the various type of tumors for this cancer. First is the epithelial tumor, which actually begins in the thin layer of tissue that actually cover the outside of the ovaries, and this is the most common type of ovarian cancer, which is 90% of ovarian cancer are this type, epithelial tumors. Next is the stroma tumor, which begins in the ovarian tissue that contains the hormone producing cell. So this is only 7% of ovarian tumor belong to this type. The last one is a germ cell tumor, which is quite rare. Okay, it started in the egg producing cell. So this one tends to occur in the younger woman. Yeah, next. So next is endometrial uterine cancer. It also called uterine cancer. So this is a type of cancer that actually begin in the uterus, and cancer actually begin in the layer of cell that form the layer, which is endometrium of the uterus, also known as uterine cancer. So endometrial cancer is often detected. Okay, this one can be detected at an early stage because it always produce abdominal vaginal bleeding. So you will be alarmed once you have a abnormal vaginal bleeding. You will actually alarm. So this one can be detected quite an early stage. So if endometrial cancer is discovered early, removing the uterus surgically often cure endometrial cancer. Yeah. So next. Yeah. Next, we look at the cervical cancer. So this is a type of cancer that actually occurs in the cell of a cervix. The lower part of the uterus that actually connect to the vagina. So caused by a virus strain of a human papilloma virus. So this is a sexually transmitted type of infection. When exposed to this HPV, the body, by right, actually the body immune system typically prevent the virus from doing harm. But only a small percentage of people, however, that the virus survive for years, contributing to the process that cause some cervical cell to become cancer cell. Yeah. So next. Yeah, next we look at the staging of the three type of cancer. First, we look at the ovarian cancer. In general, for stage 1 is localized. Okay, it's a very early stage. When we go further to stage 2, stage 3 is actually classification based on this is actually they start to spread out of the original site. So when it comes to stage 4 means they actually spread to a distant area, could be an organ. Yeah. So next. So for uterine cancer, it's also follow the same classification. Stage 1 is localized. Stage 2, stage 3 is start to spread, and stage 4 it actually spread all the way out of the original site to a distant organ. Yeah. And next one. Yeah, cervical cancer. In fact, it actually follow the same. Okay, in general, they also follow the classification, but for cervical cancer, they actually go with the sub-classification. They have a measurement of the so-called the area affected, the how big is the thing, the so-called the tumor, and then doctor will actually have a sub-classification. They have 1A, 1B, 1C, still in the early stage, but it's a different classification. But in general, it's still the same. Stage 1 is still in the localized, and early stage, and all the way to stage 4 is that it spread out of the original site to distant organ. Yeah. Okay. Now we look at the causes. Until now, it's not clear what causes the gynecological cancer, though doctors have actually identified factors that can increase the risk of the disease. What known is related to cell change and mutation in DNA. Yeah. So also known that HPV, the human papilloma virus infection, also play a very big role in the cervical cancer. But take note that HPV, this virus is very common, and most people with the virus never also have a cancer. So they also found that other factors may have contributing to this cancer. Yeah. So actually, such as your environment, your lifestyle choices, and also determine whether you have developed to this cancer or not. So very much depend on individual. Yeah. Next. So now we look at the risk factor. So in general, these are the group of people will have high risk, but that doesn't mean that you will for this group you will get it. It's just that the risk is higher. Example, the obesity. If you are obesity, if you are a smoker, and if you have family history of so-called breast or ovarian cancer, then that will have a higher risk. Okay. Now look at ovarian cancer. Ovarian cancer, this old age, age above 60. Why? Because hormones start to change at that age. Okay, and inherited gene mutation also at higher risk, and family history of ovarian cancer. Estrogen hormone, actually having an estrogen hormone therapy, also having a higher risk, but that doesn't mean that you will have it once you have this therapy. It doesn't mean that. It's just that your risk could be higher. Yeah, and the age when menstruation start and end. So this one probably they are looking at the longer time frame. You start too early or you end too late. Okay, for this so-called the cycle in terms of your, for example, menopause at the later stage. Yeah, too early to start, yeah, very young age to start your menstrual cycle. So this is the factor could have contribute to a higher risk. And for endometrial or uterine cancer, who are the people at higher risk is that those uh, uh, those people, those female actually who have an imbalance of a hormone and more years of menstruation. And just now I mentioned that it start too early or the menopause end too late. This is also a higher risk, at higher risk. Yeah. Next. Yeah. So those with the hormone have been you have been actually in hormone therapy for breast cancer. Those have never been pregnant or at an older age. So when older age, endometrial cancer occur most often after menopause. Yeah. So the other group would be having the inherited gene mutation. Yeah. So this one gene mutation you will not know until you do a so-called a detailed checkup. Yeah. So the other group of higher risk for cervical cancer is the is that they have many sexual partners. Okay, early sexual activity. Yeah, you engage all these activity. You engage early sexual activity. The other one is that other sexually transmitted infections such as AIDS, HIV disease. Yeah. The other one will be if having a weaker immune system, you're also at a higher risk. Yeah. But that doesn't mean that you will actually will have it. It's just that the risk is higher. Yeah. Next. Yeah. Now we look at the symptom. Yeah. So for cervical cancer, normally the symptom will be abnormal vaginal bleeding or discharge. Yeah. For ovarian cancer, is that you have vaginal bleeding, discharge, feeling very full, bloating, feeling full too quickly, or difficulty in eating. So next will be pelvic pain or pressure. There's some pressure around the area, and most frequent, more frequent and urgent need to urinate, or you have constipation. The other one will be bloating, and the last one will be the back pain or abdominal pain. So these are the symptoms for ovarian cancer. As for uterine cancer, is actually vaginal bleeding or discharge, and pain around the pelvic area. Yeah. So these are the common symptoms. Yeah. Now we look at the diagnosis. So for ovarian cancer, actually, it can be done through pelvic examination. So pelvic examination is that is more like a visual and a physical check by the doctor. So doctor will actually wear a glove and then use a finger actually go inside the vaginal area, and then the other hand will actually press on your so-called abdominal to do a physical check. Yeah. Next will be blood test and CA125 tumor marker test. Yeah. So this is to to the to see whether any change, any so-called marker test on this ovarian cancer. Imaging test like CT scan. Yeah. So for the endometrial uterine cancer, the diagnosis will be pelvic examination, transvaginal ultrasound, and hysteroscopy. So this is hysteroscopy is actually using a scope to actually to also look at the so-called the tissue area, and then if they found any abnormal, they will actually do a biopsy. Okay, to remove, they actually take some sample for testing for lab test, and if they cannot find anything, they still need more tissue, they actually go for surgery to actually remove the inner tissue for testing. So the last one will be CT scan and all the scan. Yeah. So as for cervical cancer, they actually do HPV, human papilloma virus DNA test and the pap smear test. So these two tests actually they can be done so-called they are taking the so-called at the same time when you do pap smear, they actually take the tissue out, the so-called some of the tissue out, the two samples, okay, one for pap smear, one for HPV lab test. So these two can be actually carried out together, yeah, for the lab test. And if they actually found abnormal and they want to find out more details, they actually go for so-called the colposcopy examination to look into using a so-called magnifying glass or a magnifying so-called scope to actually look into more details. And the next two is the imaging test, CT scan, and the last one will actually take more sample from biopsy test. Yeah, so that will be the cone biopsies. Yeah. Next. As for the prevention, as of now, there is no sure way to prevent gynecological cancer, but you can actually lower the risk by going for regular screening, like pap smear test and all this, HPV vaccination, and then also being aware of those symptoms of a different form of cancer, seeking medical advice if you are concerned. So the other one is maintaining your healthy weight, eat healthy diet. Of course, if you are a smoker, then stop smoking. That helps. Yeah, next. Now we look at the common treatment type. So for the first one, of course, there's surgery. So surgery, normally when it actually cut into a body to actually remove the tumor. But this one happens is that at a very, very early stage, that when the cancer has not spread to other area. So to make sure that all cancer that being removed first. Yeah. So this one, they will cut into the body and remove the tumor. And of course, the advantage is greater chance for cure, especially if the cancer has not spread to other part of the body. But the drawback would be surgery risk. Next, after the surgery, they will actually look at chemotherapy. So chemotherapy is that they're actually using medicine or drugs to treat the cancer. So these anti-cancer drugs are actually administered. The purpose is to shrink or kill cancer cell further. Okay, yeah. So the advantage is that they keep the cancer from spreading. Okay, slow the cancer growth, and then they kill the cancer that spread, relieve symptoms such as pain. But why relieve? Why they can relieve? Because when they stop the cancer cell from growing, from spreading, actually they help the so-called the area that being blocked. Yeah. So the drawback is that this drug will actually kill all the cell, whether it's a good cell or bad cell. Yeah. So sometimes, most of the time, you will have side effects that include nausea, vomiting, hair loss, and bone marrow suppression, and internal wall injury. Yeah. The next treatment is a radiation therapy. So this type of treatment is that they apply high energy particles to destroy or damage the cancer cell. Radiation, the advantage is that the radiation treat just the tumor and is more localized. Yeah. So the drawback is that, of course, you have fatigue. Yeah, and the skin change and your appetite were lost. Yeah. Another treatment, targeted treatment. So this targeted treatment is actually using drug to actually more precisely identify and attack the cancer cell. Yeah. So these drugs are special and administered to block the growth and spread of cancer cell. Advantage is that they little damage to the normal cell. This targeted therapy has been done for some people with NSCLC, where their cancer cell have a special mutation which the drug can target. So this is a very specific target type of drug that can be used for this type of cancer. So the drawback will be some new drug can be costly and also carry some side effect. Yeah. So next is the immunotherapy. So for immunotherapy is that it's also a drug treatment, but this kind of drug is that they help boost your immune system to actually fight the cancer. So certain type of immunotherapy, they actually attack cancer and also able to slow the spread, okay, to other body, spread the cancer to other part of body. So others kind is make it easier for immune system to destroy cancer cell. But the drawback is that sometimes this can result in the immune system attacking healthy cell, which can cause side effect. So it's all very much depend on individual. So it may actually end up to become a so-called your immune system is too high that actually have become an autoimmune system. Yeah. So the last one would be the hormone therapy. So for this hormone therapy is that they actually using medication to lower the hormone level in the body. So the advantage that those cancer cells that actually rely on a hormone that to help them grow, okay. So this would actually will help, okay, in response to actually let the cancer cell, okay, die, because you are relying on the hormone. So this now the hormone level is lower, so you actually can't depend on that to actually start growing. So you actually eventually will die. And the drawback is that might have some side effect as well. Yeah. So in general, these are the common treatment type for the cancer. Next. Now, yeah, we look at what what are the health food that actually we can consume. Yeah, a good number of health food featuring those ability that are able to regulate our physical constitution and immunity, and can lay the foundation to actually control the growth of cancer cell. So example, Ganoderma or Lingzhi has been regarded as a top grade health food in this area. Yeah. Next. Yeah. So and talk about Ganoderma or Lingzhi. So actually, what is this? So actually, this is a type of mushroom fungus, and that has a healing property. And this many people uh, know, okay, that have been many years of history. In fact, there are more than 2,000 years of history in China, and recently there are 50 years of modern scientific research uh, using Ganoderma for they are looking at the healing property. So the statement of this consistent and long-term consumption of Lingzhi helps to regulate and rejuvenate your bodily function, hence slow down the speed of aging and prolong one's life and improve the quality of life. So this statement actually have been documented in the so-called the oldest medical book in China. So one is 神农本草, the other one is 本草纲目. And more recent 50 years of modern research on this Lingzhi have been actually published, okay, in the so-called PubMed. So if you do a Google search, you can actually find from the so-called PubMed, which is a repository for all the research paper. Yeah, next. Yeah, so now we look at how Ganoderma that can be used on the cancer treatment to supplement the treatment. Yeah, if we look at the right side of the so-called our body function, the system, our body have many systems. And with all the system, they have their own so-called problem also. So which means their respective disease. So for Lingzhi, we have all these functions that are able to help all the disease in the various system. Yeah. First, we look at what are the function. First is that they are able to regulate your immune system. Yeah. When you talk about immune system, is that they actually are able to fortify your immune defense for cancer prevention. So you have, we need to have the immune system that actually build up, but it should not be too high or too low. Too high, it actually will be too active. That just now we mentioned that it's too active, they will actually attack your other organ or system. Yeah, too low, you actually have infection and virus will attack you. So the immune system must be at the optimal level, okay, at all time. So Lingzhi able to do this. Yeah. So that's why they are able to reduce the chances of infection during their cancer treatment. Yeah. The second function is that they improve blood circulation. Yeah, blood circulation is very important because when you have in good blood circulation, is that in fact you actually you are able to transport all the nutrient and all the oxygen to your various function, various system to actually need this. Yeah. So blood circulation is very important. Lingzhi is able to do this. So in TCM perspective, smooth flow of blood and qi can actually prevent formation of lung. Yeah, this according to TCM so-called theory. Third function, enhance liver function. So detoxification. So for liver, as we know that liver is like all the blood they have to actually filter out, okay, to be a clean blood recycle back to the body to be used. Yeah. So the waste they have to actually filter and clear it away. So liver function, their enzyme must be in good shape to actually do this function. So things are able to do this to prevent potential side effect of drug to liver. So it helps to elevate the liver enzyme. Yeah. The fourth function is that they able to remove free radical and anti-oxidation. As we know that free radical will cause damage to the DNA. That's how we mentioned. If any so-called your DNA change, your cell mutation, all these will be affected. Yeah. So for why Lingzhi is so good in all these functions is because of there are two major components. First is a tryptopanoid, second is a micromolecular polysaccharide. Yeah. Yeah. So now we look at the so-called the how Ganoderma in assisting cancer treatment. What is their approach? In fact, Ganoderma actually approach in two ways. First is to prevent the cancer from spreading. How they do it? They actually do it by induced apoptosis and to kill cancer cell directly. Actually, apoptosis is that what is a process that a normal cell will go through. Normal cell, a healthy cell will actually do a cell division. Okay, when they do cell division, is that the older the so-called the matured cell were actually being replaced by the so-called newer cell. So the newer cell is just continue to grow, but it actually replace the older cell. Older cell will actually eventually follow the rule. They will actually die off and clear out. Okay, this is apoptosis. But cancer cell don't follow this path. Cancer cell, at first they like a normal cell. They actually do a cell division. But the problem is they don't, once they go mature, they don't die. They keep on growing and become a problem. Yeah. So they don't follow the rule. So actually Lingzhi is actually do the part of to induce apoptosis to make sure that they follow the rule and die. Yeah. So this is to kill cancer cell directly. Yeah. So with that approach, is that it actually increase the patient survival rate. Yeah. So the next approach is that to complement treatment, okay, during your chemotherapy and radiotherapy. How they do it is that they actually do by anti-oxidation actually having a stimulating mechanism such as the bone marrow hematopoietic. Okay, so this is the, because when during chemo and during radiotherapy, your actually bone marrow will be suppressed. Yeah, because bone marrow is the area that actually build the so-called the newer cell, so-called the blood cell. They actually build red blood cell, white blood cell, and pellet. So those cells that they build during chemo, they actually suppress it because they will actually, the drug will actually kill the good cell as well as the bad cell. In fact, their job is to kill all cells. Okay, to actually to kill the cancer cell, but they are no way to identify which one is good and which one is bad. That's why there's a bone marrow suppression. And the next Lingzhi is good to reduce, able to reduce the side effect of during your chemotherapy and radiotherapy. So just I mentioned that this is evidence-based research on using Ganoderma on cancer treatment. They are actually have a lot of evidence-based research actually documented and published in the PubMed. You can actually do a Google search, okay, on the keyword Ganoderma and cancer or Lingzhi and cancer. You actually can find a lot of research paper from there if you are interested to find out more. Yeah. Next. Yeah. Now we look at the research and technical paper. Lingzhi on the cancer. Yeah. So the prevention of cancer cell proliferation or metastasis. So this one is actually talking about how Lingzhi actually, how they actually use Lingzhi to do the research to prevent the cancer cell from growing and spreading. So in summary is that here we actually give 4 so-called example of the research paper. Yeah, in summary is that they actually tretapenoid able to inhibit the new vessel formation in a direct manner. Okay, as for the polysaccharide, they are the other way around, is that they actually strengthen the immune molecule, which is the system that actually later led the system to actually inhibit the new vessel formation. So Lingzhi is able to stop them from growing is by actually stop the so-called cancer cell from growing new blood vessel. Why they do this is that cancer cell, for them to actually survive, is that they actually need, they are actually work like a normal cell. Okay, they will actually grow new blood vessel, hijack the nutrient from the system, and they become bigger and bigger. In order to survive, they have to get some food. So this is where they get the food. They form new vessel, get the nutrient, and they grow. Yeah. So Lingzhi, they can actually do this one, okay, in 2 approach to actually chop off their new vessel formation. So once they chop off, they are actually starved to death. Yeah. Another thing is that from all this research, they found that higher dose will have prominent effect on the tumor tissue, yeah, inhibition with a better result. Yeah. Next. Yeah. Yeah, here is a research, okay, on Lingzhi to inhibit the so-called the 3 cancer that the main focus of today's topic: ovarian, endometrial, and cervical. First, we look at the Lingzhi research on ovarian cancer. Here we have 4 so-called research paper. First is they are actually using Ganoderma tretapenoid actually inhibit the HER2 positive aggressive type. HER2 is the so-called related to so-called breast cancer, but actually they actually found that there is some percentage also happen in the ovarian cancer. Yeah, belong to HER2. Yeah, so they actually did a research and found that Ganoderma actually can actually inhibit this cancer. Yeah, and published in the evidence-based complementary and alternate medicine. I have put the link below if anyone interested can actually check from there. And second, they actually did the using Ganoderma extract to regulate VEGF. Yeah, VEGF is a growth factor. Okay, and the other one is the C43. They find that these two actually they need to regulate them and elevate the C43. C43 is a kind of a gene expression that actually can inhibit the ovarian cancer cell. So they enhance they actually do it by enhancing the antioxidant and detox, suppress the cancer cell. So this also documented and published in the so-called the following journal: MBC Complementary and Alternate Medicine and International Journal of Molecular Medicine. The other one will be the Ganoderma extract. Okay, it's inhibit formation of tumor and prevent metastasis and elevate effect of chemotherapy. And the last one will be Ganoderma help to actually stabilize condition of the last stage of ovarian cancer. Yeah, so these are those research and study done that published in the journal. This is for ovarian cancer. Next. Yeah. Next is on the endometrial cancer. Endometrial cancer. So they have done is that the researcher actually using Ganoderma extract to actually see whether can it actually inhibit the growth and metastasis of this endometrial cancer cell. So this one actually there is an effect on cell viability and proliferation, most probably is exerted through induction of autophagy. So this one also published in the journal. Yeah. Yeah, next. Next is the research on the Lingzhi on cervical cancer. So this one they also done, but they're using polysaccharide and tretinoin. So this one is trying to see, they actually found that they actually can reverse and stabilize the growth of the cervical cancer cell. So all these are the so-called study that have been done, yeah, and published in the so-called in the journal. Yeah, next. Yeah. So now we look at the company that has been in the business that specialize in the so-called the top grade Lingzhi product for the past 32 years. The head office is in Taiwan and the name is in as Double Crane. So in Southeast Asia, the name is we call Shuang, okay, the company. So the company actually own their in-house R&D, their Lingzhi farm, as well as their distribution network. So the company core product is the Ganoderma with rich tretinoin and micromolecular polysaccharide content. And all these products have been scientifically actually certified with various endorsements such as HSA, Singapore HSA, Taiwan Quality Food, TQF, Halal, and certified as Halal certified, and then as well as ISO. So these are the Lingzhi core product, as you can see in the slide. Yeah. Here we have here is the so-called the recommended dosage. It's actually provided. Okay, this chart is actually provided for at different needs. Okay, so this is actually recommended dosage plan based on the so-called the result gathered from the leader and the user. Okay, and it's quite straightforward. It's like for example, prevention, you need child YK1. Here we listed YK1 and YK2. Okay, so for during treatment, cancer stage treatment, you can have for stage 1 and 2, we have 30 YK1, or you can take 5 YK2 and so on. Yeah, but when it comes to after the stage 4, you are having first year after the remission, you can actually continue to actually take this so-called 30YK1 as a minimum dosage recommended. Yeah. So for second year and third year after the remission, you can actually continue, but you can actually reduce your dosage to 20. Yeah, 20YK1, and continuously follow the plan. And then after 5 year remission, okay, to continue from there is 12YK1. So after 5 year, everything good, you're happy, then move on. You can actually take it 12YK1 all the way for maintenance purpose. Yeah. So this is just a recommended dosage. Yeah. Yeah. Next. Yeah. Now we look at testimonial. Okay. So this is the Madam. It's all this testimonial from Taiwan. Yeah, Madam Mai, age 72, back in 2010. Okay, she had cervical cancer and also cancer spread to lung. So actually, at first she was diagnosed with early stage 0 cervical cancer in 1994. So that time was age 55. Yeah. So one day she was alarmed by her bloody vaginal discharge. Okay. Why she's alarmed? Because her menstruation has stopped about 6 to 7 years ago. So she was a bit worried. They went to see doctor, and ultrasound discovered some abnormality. So they did a biopsy and confirmed that she had at least 0 stage cervical cancer. So 18 October 1994, she had a surgery to remove the affected cancer due to the cancer was very near the lymph node. Okay, so after the surgery, doctor put her under chemotherapy plan. So total there are 6 sessions. Okay, she had to complete. So one session, every month there are 1 session, but 1 session is 4-day continuously type of treatment. Okay, continuously. So after the chemo plan, yeah, after the chemotherapy, she had a side effect. Okay, every time after the session, she got a side effect. Example, the tongue numbness, fatigue, no appetite, dizziness, and then feel very weak. Yeah. So continue for 5 times, and then come to the 6th time, she stopped the last chemotherapy session, which is the 6th time, the number 6, as she cannot handle any more side effect after the 5th chemo session. So 6 months later, she went for a medical check. Okay, after she have cough, okay, for quite a while, 2 months. Then after 2 months, she thought that was just during that 2 months, she thought it's just a normal flu. So after 2 months, she actually coughed out mucus with blood. That worried her. She actually quickly go and see a doctor. So on 28th of June 1995, the X-ray found some spot in the lung. Okay, so a bit concerned, biopsy done and found that there's a new cancer in the lung. So further tests confirmed that this cancer is actually one from the previous cervical cancer, which means it's spread from cervical cancer. So had a surgery to remove the affected lobe of the lung. So to prevent further, the doctor actually tell her to prevent further spread, okay, of the cancer. Doctor suggested to go for chemotherapy. Okay, but due to the side effect she had previously, she was very reluctant to go for another chemotherapy. Yeah, so she started to find out any recipe that can help her to actually go through this period of time. She started to eat healthy diets, exercise, hoping to cure the disease. So her son actually friend recommend to actually let her try Lingzhi. Okay, so September 1995, she started 9 to 27 capsule of Lingzhi and bee pollen every day. Okay, and after that, she went for medical review, and it showed that the lung condition is good and back to normal. So she has more confidence. She continued the Lingzhi and bee pollen dosage and continued for many years. So years of regular review show good and normal condition in the lung, and her cancer overall is back. No more cancer found, and her health condition and energy level also improved. So with this consistent good result and medical review showed that no sign of cancer, she maintained the link. She started to reduce the dosage and maintain it until 2014, 2010. After that, she continued with 4 capsules. So next. So testimonial 2. This one also from Taiwan. And Madam Chan, age 60, in 2014. She had ovarian endometriosis, early stage cervical cancer. So back in 1995, at age 41, she actually felt uncomfortable and occasionally pain below her abdominal area. So first visit to the clinic found that she had an endometriosis. She was referred to gynecology for further check. Subsequent visit to the gynecology, they did a pap smear and other further tests, and found that she had early stage, 0 stage, very early stage cervical cancer, in addition to the ovarian endometriosis. So one option given by a doctor was to remove the cervix, since cancer is still at a very stage. The option was actually proposed to her also because of she already had given birth to 3 children. So while waiting for her to decide, doctor suggested to start radiation therapy first. So during that time, a close relative who is a pharmacist and had good knowledge in Lingzhi actually recommended her to take Lingzhi for a period of time first. Why? Because to save the, actually he tell her, say that if her condition improve after taking Lingzhi, her cervix can be saved. Otherwise, if it's no improvement, she can actually then decide to remove the cervix as a last option. So she and the family agree. So after taking Lingzhi for 1 month, she went for her medical review to continue the radiation therapy. To her surprise, doctor said no further radiation therapy is needed, as everything back to normal. So she was so happy that her cervix was safe without any further treatment needed. So, but her next problem is on the ovarian endometriosis. So they actually have a 3 cm tumor on the left ovary and 5 cm cyst on the right. So doctors actually told her that it's not so urgent concern. So just have to monitor and review every 3 months. Okay. So actually the doctor actually give her the number to call. So they tell her that only need to call in case she has any sudden pain over the abdominal area. Okay. So she went back, she continued the Lingzhi. So for every 3-month review, okay, it's so amazing that the size of the cyst, okay, continue to reduce by 1 cm. So after 5th visit, okay, every 3 months there's 1 visit. So after 5th visit, no tumor and cyst found. So she and her family continued the Lingzhi, okay, as they have gained more confidence that actually Lingzhi can improve their overall health. So actually, in summary, is that Lingzhi, in fact, just now we talk about the research paper that it actually helped in the so-called stop the cancer cell from growing and actually stop the spreading of the cancer. So in fact, as you can see from these 2 testimonials, it actually did help to actually reduce the size of Lingzhi, reduce the size of the so-called the tumor and the cancers. Next. So for Yongkian pollen, this is another product. It's a pollen. So this is the most complete food on, they have more than 200 plus nutrients. So this is more or less during treatment, we actually can consider this because it provides most of the nutrients our body need. They actually provided more than 16 vitamins, more than 16 minerals, 21 amino acids, and 21 nucleic acids. And they have more than 94 enzyme and coenzyme. So this actually able to help us regulate nutritional imbalance, okay, calm our nerve and relieve stress. Also help in weight loss. So increase stamina and remove fatigue. So this is what we need during the chemo, because your side effect is that actually make us more weak and fatigue. And fortify our immune defense. Enhance, the other one is very important, is that enhance the absorption of Lingzhi. So when you take together with Lingzhi, it's better absorption. Next. Here come to a conclusion. So cancer is still one of the most dreaded diseases. And Ganoderma is one of the best health food to actually prevent and also complement treatment of cancer. And Ganoderma enhance our body immune system. Not only enhance, it actually regulate. So use a Ganoderma together with surgical removal, chemotherapy, radiotherapy. In fact, it's all effective in improving our condition. So other Shuang products like bee pollen and protein can actually be considered as part of the balanced diet, during the treatment. Yes, I think with that I end my presentation. Thank you.